Kia ora koutou katoa. Welcome again to the Ministry of Health. Thank you for your ongoing interest and support on this issue. So earlier today, the Ministry of Health confirmed a fourth positive test to COVID-19 in New Zealand. This positive result is for a New Zealand citizen in his 30s and is the partner of the second case announced earlier this week. Immediate details of the case history of the Auckland couple who recently arrived home from northern Italy were outlined on Tuesday. Further contact tracing is underway for this individual and close contacts are already in self-isolation. This man has already been in self-isolation at home since Wednesday. He has appropriate clinical support from Public Health and District Health Board staff. As I've said earlier on, self-isolation at home is an appropriate response for people with mild to moderate symptoms as recognised by the World Health Organisation. He does not require hospital-level care and neither does anybody else in the family home. I can also advise that this confirmed case attended the Tool concert at Spark Arena in Auckland last Friday night, the 28th of February, when he may have been infectious. He was in the general admission standing area in the front left-hand quadrant. So, we encourage all people who were in the general admission standing area to be aware of the symptoms of COVID-19. I should add that everybody in New Zealand should be aware of the general symptoms of COVID-19, and they are very well detailed on the Ministry of Health website. If people are concerned, we encourage them to contact Healthline's dedicated COVID-19 number 0800 358 5453. Now, I should say that those people who were in the standing area are casual contacts. They are not close contacts, they are casual contacts. The advice is that they just be aware, as everybody should be, of the symptoms of COVID-19. Our advice is the risk is very low for all others who attended this concert. There is very good advice on our website regarding mass gatherings, and please do check the Ministry of Health website for that. This relates not just to this event, but for anyone attending other events, for example, like the Ironman, which is in Taupo this weekend. I want to repeat earlier advice about medical centres, as there has been continued media interest in naming centres with positive cases. There is no need to name centres. We do not want the public to be concerned about visiting their general practices for routine visits. We want people who need health care to be able to attend their general practice and not be concerned about attending. If someone has visited a centre and is considered to be at risk, as part of our ongoing contact tracing, they will be contacted by public health officers. Those officers will determine if there is any risk to both staff or other people who may have been at the centre at the time, and appropriate contact tracing and action will be undertaken as required. There has also been questions around naming other places of interest linked to cases, such as employers. We would name those places if it is necessary as part of the wider public health response. In cases to date, employers are being advised directly by local public health officials over the appropriate actions they may need to take, and anyone considered a close or casual contact is given appropriate information. We would make the employer or other place public if it was to assist with the public health response. The Ministries of Health and Education continue their support for students and schools involved linked to confirmed cases where there may be a contact who has been at those schools. All students identified as close contacts of confirmed cases are at home in isolation and they continue to have no symptoms. We do not believe there is any current risk to staff or students in any of the schools that we have talked about over the last 2 days. Testing, we've now completed 212 negative tests, and we obviously have the 4 positive tests. A number of tests are underway today. I don't have the exact number, but as is the same every day. One of the tests underway today includes the father of the case that I spoke about yesterday, case 3. He was offered testing and accepted that testing. I should say that if the test result is positive, we will be able to consider him then a confirmed case. If it is negative, we will still consider him a probable case because we are confident that he was the symptomatic case that came back from Iran and then passed on COVID-19 to the man who is case 3. We will also be offering testing to family members of cases with fully informed consent, that is, those who are asymptomatic. Symptomatic family members will be tested. Those who are not symptomatic will be offering tested with full informed consent regarding what the implications of a positive or negative test may be. Just quickly, I want to talk about the testing process and why it may sometimes seem we are taking some time to announce test results and the implications. We are trying to announce test results in a timely way, but it's important to understand the steps involved. First of all, when a doctor or health worker suspects a person of having COVID-19, a swab will be taken, and it takes time then to courier that swab to the lab for testing. The test takes about a day to return a result. Generally speaking, results for the previous day come in the early evening. So tests that are taken today would, after 10 o'clock, are run tomorrow, and we get the results in the early evening. If the case is positive, the lab then has to contact and notify the diagnosing doctor and the local medical officer of health. The local medical officer of health then notifies the Ministry of Health. Importantly, though, the diagnosing doctor and the local PHU, Public Health Unit, work together to inform the case and their whānau of the positive test. There is then a very thorough, systematic interview undertaken with the case to get information about where they have been, places they may have travelled, which might include flights or other public transport, events they may have been at, and so on. Contact tracing begins quickly, starting with the close contacts. The initial close contacts, of course, are other family members. A reminder that close contacts involve a situation where someone comes into close proximity with someone, which is regarded as closer than a metre for more than 15 minutes. In the case of air travel, as you know, close contacts are people who were in the same row of seats, 2 rows in front and 2 behind. Simultaneously, the Ministry of Health is following a very detailed protocol to notify all the key stakeholders, which does include notifying the Minister of Health, colleagues at Department of Prime Minister and Cabinet, Healthline, that is home care medical, so they can scale up operations and plan for any increase in calls, and other government agencies, for example, border agencies, so they can initiate their protocols. We also have obligations under the international health regulations to notify the WHO and the national focal points of other countries if there are people who are close contacts and who may have travelled on to those countries. And finally, of course, our health and emergency services colleagues need to be notified so they can put in place mechanisms to keep their staff safe. Healthline had another very big day yesterday, and they continue to scale up their staff numbers to deal with the interest there is there. Just to remind callers to reserve Healthline for people with health concerns. Anyone wanting information on COVID-19 should go to the Ministry of Health's website in the first instance, and if you want advice on your own forthcoming travel, please look at the Ministry of Foreign Affairs and Trade's Safe Travel website. In terms of expert advice, our expert advisory group met again yesterday. That group, which is called the Technical Advisory Group, or TAG, was specifically set up to support our advice around the response to COVID-19. It includes national infection control experts, public health experts, and clinicians, both primary care and hospital clinicians. At the border, as you will know, restrictions remain in place for anyone who has been to or through mainland China or Iran in the past 14 days. And those people coming back to New Zealand are required to self-isolate for 14 days since leaving those countries and register with Healthline. People travelling back to New Zealand from the north of Italy and the Republic of Korea will be talking to health staff at the airport. We have a strengthened health presence at the airport and advise they need to go into self-isolation and are also required to register with Healthline. So in summary, in the words of the World Health Organization Director General, based on what we currently know, COVID-19 spreads less efficiently than flu. Transmission does not appear to be driven by people who are not sick. It causes more severe illness in some people than flu, and we do not have any vaccines or therapeutics as yet. We treat people according to the symptoms they have, and it can be contained, which is why we must do everything we can to contain it. From the point of where New Zealand is in the global outbreak, WHO's recommendations and our pandemic plan are clear. It includes active case finding. We want to find cases. Finding cases indicates success, not failure. It's fundamental for our effective public health response and to protect the community. I want to thank everybody for the work they are putting in to help with this response. And for anybody in New Zealand, in addition to knowing what the symptoms of COVID-19 are and those key messages about washing hands regularly, I think everybody now knows, but it's worth repeating, 20 seconds with soap and water, and cough etiquette and social distancing, and please not going to work or sending children to school or other places if they are unwell. If you do want to do something to prepare this weekend, my suggestion is to reach out to friends, neighbours and others in your community, particularly older people and people who may be less able to look after themselves, and check that they are okay and check that they have a plan and what you might be able to do to help them in the months ahead. Thank you very much. I'm open for questions.
How many people in this standing area of this tool concert could have come into casual contact with the confirmed case?
I'm sorry, I don't have the exact numbers.
Are you going to contract to trace those people that were in the area, same area as the person at the tool concert?
No, because there's no way we could know which people were in that area. So the advice to them is that they are casual contacts, they're at low risk, and the appropriate action for them is just to be aware of the symptoms, call Healthline if they're concerned or if they have any symptoms.
Do you have an update on the patient in hospital?
Yes, my understanding is that that person is getting better and discharge planning is underway.
Do you have a clear idea of the total number of people the ministry is trying to contract, that might have been at risk from the confirmed cases at all?
I actually am waiting for that information, so I will provide it as soon as I have it.
In regards to case number 2, she was at a cheerleading event, she took 2 domestic flights and she went to 2 GP practices. Do you have a number of people that she might have been in contact with?
So the people we're focused on, of course, are the close contacts. We're very confident, the Public Health Unit is very confident it has identified all close contacts. It did that on the night that we got the positive result, and those people are in and have been in self-isolation since. We have notified all the other casual contacts since. I expect it's a reasonable number, and I am awaiting for that information. Recalling that our Auckland Regional Public Health Service is in the process of following up 4 cases at the moment, and that is where their focus is.
What about people that might have been sat next to these cases at airport gates, not the flights, but the gates for 15 minutes?
It's virtually impossible to identify who those people might be, and so the advice to them is the same as our advice to the general public. We would classify them as casual contacts. It's impossible to tell whether they might be close or casual, and they should be aware of the symptoms. All that information is on our website.
So what is your message to people that went to the Tool concert? Because obviously there'll be a lot of people listening now dialing up Healthline. Who should be calling, and should they be concerned?
Yeah. So our assessment is that the risk is low, and that the people who we are considering as casual contacts are those who were in the standing area at the concert. In particular, we know that this person was in the front left quadrant generally, so people there may be at slightly higher risk, but again, the risk is low. And the key action is just keep an eye out for any symptoms, and they should know what those are, and if they have any concerns or they want to know information, they could look at our website or call Healthline.
How many people are in isolation that are deemed close contacts with confirmed cases?
Again, I have asked for that information, but over the last 24 hours, our focus has been on supporting the Public Health Unit with identifying close contacts and getting them in self-isolation. I will provide it once I know it. Yes.
Can we go back to yesterday's case number 3 with the grandparent? So I've listened back to the press conference yesterday, and there was some confusion around in the early part you said there were 3 members of his family that had been unwell. So I allocate that to 1, the grandfather. Who are the other 2 that had been unwell that are in that family?
Yes, so the 2 people that, actually there are 2 people I know have been unwell and they have now been swabbed. That is the case's partner, and she was swabbed yesterday and we're waiting for that result. And now the father, or the grandfather in the household who had travelled back from Iran has also been swabbed.
So there are 6 people in isolation in that house to do with that family, the 2 children.
Correct.
Okay.
And so a total of 3 who had symptoms.
Okay.
Yes, including the case.
Thank you.
Yes. Was there another question?
Have GPs been offered protective gear yet?
Oh, absolutely. In fact, we've gone to great pains to work with DHBs and primary health organisations to ensure that early this week, every practice had PPE, or as we call it, in the practice. There were some that didn't and were concerned. They all now have it. I'm very, very confident of that, and we've been very active in ensuring that's the case.
There's been some international reports of 2 different strains of the coronavirus or COVID-19.
Yes, an initial report out of China suggesting that there was a slightly different strain, an initial strain in Wuhan, and then a slightly different strain elsewhere. I read the report on that. It's very early findings and needs further investigation to see if there's anything to that. But it doesn't change the public health and medical response.
What's the ministry's advice ahead of a lot of big events? You've got one at there's graduation, there's the mosque anniversary, which I heard this morning there's 80,000 people gathering to attend. What is the ministry's line there?
So the first piece of advice is if anyone is symptomatic with an influenza-like illness or a cold, then they should not attend those events, because that is the best way to protect others. The second is for people attending those events, please do look at the advice on our website around attending mass gatherings, and please do just follow those basic hygiene precautions, particularly the hand washing.
NZMA has expressed some concern. Expressed concern some medical clinics could close due to not enough staff being able to operate safely. What support is being given to general practitioners?
So we've had primary care general practitioners involved in our planning right from the start, and the NZMA, Kate Baddock, has raised these issues with us, so we've got some work underway just to look at how we can support primary care practices. Of course, the first thing is we've made sure they've all got PPE. The second thing is reiterating that message that anyone with symptoms that thinks they may be due to COVID-19, for example, a travel history, should ring ahead to the practice and not just turn up and or ring Healthline.
This person in the steel mill in Auckland, which case is that? Is this case number 4?
I'm not quite sure what you're talking about.
Steel NZ have put out things today warning that one of their workers is one of the confirmed cases. Which one of these is it?
So my understanding is that was case 3, is the person we talked about yesterday, and so saying that person does not work in the wider mill, and all the close contacts of that person were contacted immediately on the evening when we got the result and are in self-isolation.
Do you know anything about the case of the mountain bikers from Italy? Are they in self-isolation on Ministry of Health orders?
So my understanding is they're with the help of the Italian embassy here, and also with the company that was leading the tour, that those people are in self-isolation, yes. That's my understanding.
Are you able to provide more details as to where the grandparent or father of case number 3 and that man were? Because they were in New Zealand and became unwell for a significant period before there was a confirmed case of COVID.
Yeah, so just with respect to the grandfather who returned from Iran, his symptoms were very mild, and he'd undertaken a long journey and quite jet-lagged, so my understanding is he was largely at home, but we have followed up any close contacts and or casual contacts there to make sure that we've assessed the risk properly. So they hadn't travelled far, and all the travel they had done was in private vehicles.
Okay. I'm hearing from suppliers that DHBs have been panic buying or increasing their reserves in terms of PPE gear and masks and stock like that. Is that
well, I think there's a difference between panic buying and judiciously increasing their reserves. So I wouldn't be surprised if they're increasing their reserves and making sure there are reserves. I should say that we have got our own mask producing factory here in New Zealand, and it's underway with and it can produce about 1 million extra masks a month. There's 2.5 million on back order underway, and we also have the 18 million already in a reserve stock. That's on top of what DHBs may have had already.
The total number of people you're trying to contact, just going back to this, are we talking the hundreds or are we talking the thousands?
Oh, hundreds. So and recalling there are these two distinct groups. So the close contacts actually would be, I think, much, much lower than that, but we will get the numbers across the total. Of course, the casual contacts, especially if you add in, for example, the concert, the tour concert, that could be up in the hundreds, but again, they're at very low risk, and it's just being aware of the symptoms and knowing what to do if they become symptomatic. And can I just reiterate, for whatever the forthcoming gathering or event might be, if people are not well, then they shouldn't be turning up because they are putting others at risk.
The WHO, their latest report they just put out an hour ago, still says there's only 2 confirmed cases in New Zealand. What's sort of the information sharing that the Ministry has with the WHO?
Yeah, it's quite a formal process of notification, and it does take time. Of course, it depends on, we notify, but then it depends on the number of cases they're having to enter in the system at their end. We saw with the second case they were pretty rapid at doing that. Probably a little bit of a backlog now for the third and fourth case.
My last question is just the children. There's 4 involved with direct confirmed cases. Are they still all
They're still symptom-free, and they were symptom-free when they were at school, so they were contacts, not cases, and not likely to be spreading the infection.
Do you know how many people were at this cheerleading event as well for case number 2?
Sorry, I don't know. Thank you very much. I really appreciate your ongoing support and interest.
Thank you.